A healthy London for me looks like a place where when we're feeling alone, we can connect with other people and share our experiences with other people.
Where young families would want to raise their children, where older adults, when they move to retirement, would want to stay because it's a place where you can get out in the streets and move around safely.
Full of people who are able to enjoy life to the fullest, regardless of their background or their socio-economic position.
The Mayor needs to deal with the proliferation of fast food outlets that we've got, betting shops, and the way that alcohol is licensed and promoted.
It's very easy, particularly for people on low incomes, to choose unhealthy options for meal times because it is so much more economical than going to a supermarket and buying healthy options.
One thing that can make young people healthier is to know what they're eating, to make them aware about cooking and things that they're putting into their food.
Sometimes people don't really understand that they need to eat healthy until something life-threatening happens to them or someone around them.
I think the one thing that would make young people healthier is that if we were actually teaching them something that they actually understood and that's related to their lives in our curriculum when we're teaching it to them.
People should laugh more, smile more, it's healthier for your body. And to walk a lot more, do more exercise and eat healthy.
I think if maybe between tube stations you were actually told the distance it would take to walk.
Do something about cleaning up the air in London and do it fairly quickly.
Air pollution, well, it should be improved so we could travel to central London and without worrying about that.
Well, I think there's still too much smoking, so that's something that needs to be addressed. I think just ban all smoking on the streets, really.
Let's be the city that leads mental health and good mental health.
It's really easy to recognise the people who will become socially excluded. I can go to a nursery down the road and I will tell you who's going to be in Providence Row in 30 years' time.
We need more access to gym facilities. They need to build on what they did with the 2012 Games, get more schools involved in sport, after school clubs, making sure there's healthy fruit for young children, putting on more clubs and sports where possible.
It's absolutely vital that we take responsibility for our own health. And also I would go further to say that once we've done that, we can also seek to become more involved in the way in which health services and care services are shaped and planned.
The access to general practice in London isn't as good as we'd like it to be. And also we know that, in fact, you look at the studies, if you've got good access to your general practitioner, you have less use of A&E, you're admitted less, you attend less, and your patient outcomes are better.
The 20th century was a century of evidence-based care. The 21st century is a century of personalisation. It is about the people themselves.
It's a time for generalists now. People have a responsibility across a range of issues. No longer can we deal with a specific illness. You need to deal with the whole person and you need to deal with the family behind that. And for us, that's the integrated care.
Help facilitate the relationship that the private sector, the public sector and the voluntary sector have together. Only by solving problems together will they actually make any long-term behavioural change.
The academic health science centres and their networks are critically important, but there's got to be someone who brings them together.
It's going to require an awful lot of people, a lot of stakeholders to work together to actually change things and improve the health of London.